Hi, welcome back. Here I am with an important question which is on priority. Is on the topic diabetic ketoacidosis. If you're thinking insulin is the right answer, I bet you're wrong. And most of the students fail because they think the other way around. So I'm going to give you an example and tell you the exact rationale how to walk through the answer. Please stay tuned. The scenario states a client with diabetic ketoacidosis is admitted to the emergency department, and the assessment finding says the blood glucose level of 612 mg per deciliter and the BP is of 88 by 54 mm of Hg, and the heart rate is 124 beats per minute and the respiratory rate is 32 beats per minute. Urine, the ketone bodies are present. And which prescription should the nurse implement first? The options here are initiate a regular insulin IV infusion, B. administer potassium chloride IV, and C. start a 0.9 normal saline IV bolus, and option D is obtain a 12-lead ECG. So think which will be the right answer. I guess you have already guessed the right answer. So let's go into the answer. No, if you're thinking administer regular insulin IV infusion, then I say your answer is absolutely wrong. This is the trap where the Nclex has fixed. It is start 0.9% normal saline IV bolus. Why? Because the client is already hypotensive, it has been stated in the question, and tachycardia is also there and severe dehydration is present. Circulation is the priority, so to compensate the circulation, we should always emphasize on IV fluids, that is 0.9% of normal saline. Insulin without fluids can cause a vascular collapse in the patient, and potassium is addressed once the insulin has been corrected. And we can see why the other options are wrong here. If you are giving fluids, it is always the best option. Why? Because insulin is given later and potassium is corrected hence after. It's worsens the hypotension. So we are correcting the potassium. It is not the most important because there is no fluid only in the body. So we have to first give IV fluids, then correct insulin, then give potassium. Then later only is the ECG because the patient is in shock. We need to act appropriately and treat the DKA situation, since the glucose is 612, which comes first. So here always the fluid wins and the insulin fails.